Who are the national consumer voice for quality long-term care? Stick around. Hello out there. Welcome back to the Nursing Home Abuse Podcast. Today, we have an episode that's spotlighting the leading organization advocating for the rights of long-term care residents across the country, and that is the National Consumer Voice for Quality Long-Term Care. We have back again on the show Lori Smetanka from that organization, and she's going to tell us all about their mission, what they do, and how you can help them advocate on behalf of nursing home residents. But before we get into that, we are going to have our nursing home regulation question of the week. This week, I want to say this is probably medium hard. I feel like they're all medium hard. Like, it's very rare that we have a really hard one. It's really rare that we have an easy one. But I'm just going to say this is medium hard. So if you get this right, give yourself a chocolate chip cookie and let's say 66 points. Under 42 USC 483.70H, the nursing home's medical director is responsible for A, hiring and firing the attending physician, B, providing direct care to residents, or C, coordination of medical care at the facility. And that answer is C. The medical director is responsible for coordinating the medical care at the facility. And now it's time for everybody's favorite ChatGPT generated nursing home regulation joke of the week. And just remember, folks, that this is AI's attempt to blend humor with the United States Code. So set your expectations to disappointed.
The ChatGPT generated nursing home regulation joke of the week.
Skynet.
Under 42 USC 483.25I, nursing homes must provide appropriate respiratory care. Why? Because someone has to compensate for the air being sucked out of the room by all these regulations.
And there you are, folks. Further proof that the singularity is many megabytes away. All right, now let's get into the meat and potatoes of the episode. This week, we're talking about the National Consumer Voice for Quality Long-Term Care, a tremendously amazing organization. And we're not doing that alone. We have the executive director who took time out of her day to talk to us, and that's Lori Smetanka. Lori Smetanka is a prominent advocate for long-term care consumers with vast expertise in nursing home and long-term care policy. She testifies before Congress and collaborates with federal agencies. Previously, she directed the National Long-Term Care Ombudsman Resource Center for 12 years. Lori's dedication to advocating for individuals receiving long-term care and services is recognized nationally, and we recognize her on this program today. Lori, welcome to the show.
Great to be here. Nice to see you again.
You know, it's funny to me, probably not funny to anybody else or relevant, is that I had on the same tie that I was wearing on our last show together. So I had to go run and change ties so it didn't look like I only have one tie, like that one Seinfeld episode where the lady only has one dress.
Yeah.
Anyway, I'm so glad to have you back on. Last time we talked about staffing. This time I wanted to have you back on just to essentially highlight your organization. So this is the most softball question that you're ever going to get in your life, but who are the National Consumer Voice for Quality Long-Term Care?
Well, I really appreciate you having us back to talk about the work that we do at Consumer Voice. So the Consumer Voice is a almost 50-year-old national nonprofit advocacy organization. We were founded in 1975. We came about because of public concern at that time about the quality of care in nursing homes. There were a lot of abuses that were being reported in the press and a lot of complaints about the quality of care. And our founder brought together groups of advocates from across the country and formed the organization to advocate to improve nursing home care and for individuals receiving care and services in the facilities to protect rights and to improve quality of life.
So, wow, 50 years. That's pretty good.
Right. Next year will be our 50-year anniversary.
Wow. Are any of the original founders still around and kicking and rocking and rolling, or what?
Absolutely. Our original founder, we're still connected with her. She's retired now, but I had actually had the good fortune to see her just a few weeks ago. And we still are very connected to a lot of people who were around at the beginning stages of the organization. We're very lucky in that respect.
So, the consumer voice is advocacy. That's the main mission, right? But like on a day-to-day basis, what are you guys doing?
Right, absolutely. Well, so we do our work in a couple different ways. We look at the work that we do in terms of how we can represent the consumer voice, the voice of the person receiving care and services, family members, people needing long-term care. And so we are the leading national voice that represents consumers and issues in long-term care. And we do that in a few different ways. One is that we are very focused on advocating for public policies, laws, regulations, practices that support quality care and quality of life that is responsive to consumers' needs in all long-term care settings, whether that be nursing homes. We also have expanded our work to include assisted living, personal care. But we really focus on trying to advocate for public policies that support consumers' perspective. And that was the topic of what we talked about last time in terms of staffing, because there are new laws, there's new regulations rather that we've been advocating for a long time to improve requirements related to staffing. So that's one thing that we do. We analyze and comment on laws. We serve as technical experts with policymakers. We issue reports and briefs to influence policymaking. We also importantly work to empower and educate residents and family members about their rights, about how to advocate, about where to get help if they should need it, if they're not having a good experience in a long-term care facility. So we provide a lot of information on our website, which people can access at www.theconsumervoice.org. But we also respond to requests for assistance. We're not a direct service provider, so we can't get involved in your case specifically, but we can refer you to an ombudsman, to a legal services program, or to an attorney in your area, or we can refer you to resources in your community that can provide you some assistance. But we want to provide information that people can use to self-advocate so that they can go and say, hey, these are my rights and I'm entitled to these services, and you should be helping me if that's in the nursing home. We also work to help support resident and family council development because that's a big part of advocacy in long-term care. So we do that as well. And then we also work to train and support other advocates, including long-term care ombudsmen, so that as they are working to advocate on behalf of consumers, they have the tools and skills that they need to do that very effectively.
Um, so how big is the consumer voice? Like how many people and are there departments and tell me about that.
Mhm. We are a small but mighty organization. We actually just added our 10th staff person. So
Wow.
we are just a small team of 10 who do just a tremendous amount of work.
I,
And
I only
we're really
laugh.
proud of the work.
No, I'm sorry to interrupt. I'm only laughing because I thought it was 10 times that. Like you guys do
Yeah,
so much stuff and you just added the 10th person. That's amazing.
yes.
That's
We
amazing.
just added a 10th person about a month ago, and we are proud of the work that we are able to do and the impact that we are able to have. And we do rely, with a lot of support, not only on our staff, but on our board. We have a leadership council of advocates around the country. And one of the hallmarks of the work that we do is that we stay very connected to people that are receiving services, to residents and their families, and they help guide and direct the work that we do. So we include residents and family members on our board and leadership council. We also have advisory committees of residents and family members that we work with on a regular basis to help guide and direct our work.
Um, do you guys do like I understand that you put together position papers and you put together reports and stuff, but like, are you guys doing
Right.
anything in terms of like, I don't think lobbying is the right word, but like communicating with our representatives on the federal and state level?
There are some restrictions on lobbying for nonprofits, so we certainly work to adhere to that. But we absolutely do work with congressional members and staff in Congress, both senators and representatives. We don't do as much at the state level. We rely on our state partners to do state advocacy, but we regularly work with members in Congress and their staff. In fact, our policy team does a lot of Hill visits and education of staff members, but we also work with agency staff. So representatives from the Centers for Medicare and Medicaid Services, for example, which is the agency responsible for regulating nursing homes and overseeing nursing homes. We work with them a lot. We bring the consumer voice to that policy table. Sometimes literally, we've arranged dialogues between federal officials and residents historically. We do that on an annual basis, but we work very closely with agency staff as well, Department of Justice, the Centers for Medicare and Medicaid Services, and other agencies.
Amazing. I'm still reeling from you having 9, now 10 people.
Yeah.
So tell me then, like, how do you guys determine, like, on the advocacy level, like,
Sure.
or in terms of that topic, how do we know? Obviously, I know that you're advocating for the nursing home resident, but like,
Right.
how do you know what to do? Like, is it like, hey, this year we really want to try to tackle staffing, or maybe based on the administration that's in the office right now, maybe we can get this done, or something like that? Like, how does that work?
Sure. So we work with our board and leadership council to establish our advocacy priorities. And they've been fairly consistent over time in terms of the main priorities that we're advocating for. You know, we focus broadly on issues related to quality, related to rights protections, related to self-empowerment. And so we really kind of work under those types of umbrellas. But there are some certain issues that have been repeatedly ones that have needed attention, like staffing in long-term care facilities, which, as we mentioned, was the subject of our last conversation. That's one where there has been a real need for very focused and a lot of advocacy, and that's one that we have done some work on. Enforcement of standards is another area that we put a lot of attention into, because the standards aren't any good if they're not being enforced and facilities being held accountable for them. In the last couple of years, we've increased our efforts around advocacy around transparency and accountability of nursing homes and owners and operators of long-term care facilities with respect to the care that they provide in the facilities, or that they allow their facilities to provide, and also with how they spend the money that they receive from Medicare and Medicaid, which are public dollars. And what we have found and what we're concerned about is that too much of that money is not going into direct care. So we see nursing home companies being very highly profitable, and yet they are shortchanging the amount of staff that they have available, the amount of resources and supplies that they're putting into nursing homes, and residents are suffering. It's very connected to the work I know that you do in terms of what you see with your clients. So we've been very focused much more in that respect over the last couple of years. And then there are a lot of opportunities that come up. As you mentioned, sometimes administrations are very focused in certain areas. And so, or Congress may be focused in a particular area. So we also look for opportunities that fit into our priorities in terms of establishing, where we put our time.
Tell me about the annual conference you guys put on.
Sure. So one of the ways that we work to educate and equip not only residents and family members, but also other advocates from around the country is through an annual conference, which we hold in the fall of every year. This year, it's going to be at the end of September, September 23rd through 26th. We're going to be in San Francisco for the first time this year. But usually it's a 2 to 3 day conference where we bring together advocates from across the country, policy experts, government officials, issue experts, people that provide best practices in long-term care issues, practitioners, direct care workers, there's attorneys, there's a whole range of advocates that come together. We host a number of different programs so that we can provide training and resources and information, peer-to-peer learning. It's a great opportunity for advocates to connect with each other and learn from each other in terms of skills that they can take back and implement in their communities. It's also a great place for residents and families to connect with each other and to make their views known. And we're really thrilled that every year we've been able to bring residents from the local area to our conference as special guests. We host an empowerment banquet. We encourage them to come and they're our guests while we're there. But one of the things that we do while we're there is we host a special dialogue just for residents and federal officials from federal agencies and state agencies, so that they can hear directly from residents about issues that are important to them and what their experiences are in their long-term care facility. And that has been a really powerful opportunity for residents to have their voices be heard and for federal officials to hear directly from the people that are the recipients of the policies that they implement.
Y'all have so much excellent and useful material on your website.
Mm-hmm.
If a family of a nursing home resident or the nursing home resident, him or herself, looks at that information, uses it to better their own situation, but has questions, did I hear that right, that they might be able to call your office to try to understand better the materials or just ask a question? Is that something that's available to the public?
Absolutely. People can call our office or send us an email. We have an email address on our website. It's info@theconsumervoice.org, and a staff person will respond and try to help them as best as possible with respect to whatever questions they have, maybe direct them to resources that might be useful for them, or put them in touch with resources in their community, such as an ombudsman program or someone else who might be able to help them directly. So absolutely, we do field calls from residents and family members on a regular basis, almost on a daily basis, and we provide as much support as we can. As I mentioned earlier, we don't provide direct care, so we can't really get involved in the direct advocacy. We just don't, with 10 people, we don't quite have the capacity to do that, but we do try to refer people out. Mm-hmm.
And here's the kind of the vice versa, that how can the public help you? How can the public out there that's listening help your advocacy and your organization?
Mm-hmm. Absolutely. Well, there's a few ways that they can do that. Number one is we are a membership organization, and it really helps to be able to say that we're representing as many voices as possible who are members, and our membership rates are very reasonable. $40 for an individual, and actually for residents, the membership is free. So we encourage people to become members, and with that, they get access to all kinds of information from our organization, as well as discounts in our store and deep discounts on our annual conference registration. So we hope that folks will join as members. Residents and families, we would encourage to contact us for more information about joining our consumer advisory councils. We have one that is made up of residents or former residents of long-term care facilities, and one made up of family members, where they come together on a periodic basis to talk about a variety of issues, to connect with other residents and families from around the country, and to provide input into the work that we do. Some of the things that residents and families that work with us have been able to do or be part of webinars, policy briefings. As I mentioned, we've been able to connect them with federal policymakers, including the administrator of the Centers for Medicare and Medicaid Services and others. So there are some great things that we're able to do with those. And we also provide information for people about how to engage with their policymakers. We have advocacy information on our website, and we periodically put out action alerts or calls to action, or share tools or resources for how people can engage with their policymaker in order to make their voice heard on a particular issue. In fact, just today, we sent out an action alert around an issue that needs immediate attention, and it needs consumers to pay attention to and to contact their legislators with respect to protecting the staffing rule that just went into effect. There's efforts to repeal it and to stop its implementation. And we need consumers to pay attention to that. And so we send out action alerts that people can just either use and adapt to contact their member of Congress, or frankly, even just click a button and it'll send a letter for them. So we try to make it as easy as possible.
And I'll make sure that in our show notes, we have the website for how to become a member.
Great.
It's so we can all contribute to your cause. Thank you so much, Lori. This is, I really enjoy talking to you, and I really appreciate the work that your team, the DECA super team, is completing on a daily basis for our long-term care residents.
Well, thanks so much. It's always great to talk to you as well. I appreciate your support and giving us the platform to raise visibility, and look forward to continuing to connect with you, Rob. So thanks for having me.
Well, folks, I hope that you found this episode entertaining and educational. If you have an idea for a topic that you would like for me to discuss, please let me know. If you have an idea for someone that you want me to talk to as a guest, please let me know that as well. New episodes of the Nursing Home Abuse Podcast come out every single Monday, wherever you get your podcast from. And they are available on the YouTubes as well as our website, nursinghomeabusepodcast.com. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.